I know this thing is on, and I know that you can hear me. Nursing and healthcare needs advocates and activism. So what are you waiting for? Let's do the damn thing. The future is here. AI and technology is here, and it is here to stay. There's no running away. There's no shying away. There's no, I can't do this, or what I did or how I did it worked way better. It's not gonna cut it anymore. Okay, pop quiz. You tell me what these various different movies all have in common. I, Robot, Avengers, The Age of Ultron, Terminator 2, and Alien Earth. Sorry, it's not a movie, but it's a TV show. All of these films involve artificial intelligence and humanity. So, what about the intersection of humanity, artificial intelligence, and healthcare? It's here. So we better talk about it. The conversation that's defining our future is here, and we can't run away from it. Is it the solution to burnout or a threat to our professional soul? Is AI going to take over our roles or our jobs? Or is it going to make life easier and better? Is it an if or question? To guide us through this high stakes intersection of tech and healthcare, we literally have here today the titan of nursing leadership in AI. Our guest, Rebecca Love, is the first ever nurse that was featured on TED.com. She's the founder of Nurse Hackathon Movement, also the co-founder of the Commission for Nurse Reimbursement, and the co-director of the nation's first nursing and AI innovation consortium. She has been recognized as one of modern healthcare's most influential people within healthcare. Rebecca's entire career has been about empowering nurses as innovators. As AI moves from the boardroom concept to a clinical reality, we have to ask, when the algorithm gives a patient a recommendation that contradicts a nurse's gut feeling, what saves the patient? The data, the human, or collaboration of both? Let's get into it. Welcome, Rebecca, to the show. I'm so glad that you're here. And first and foremost, could you maybe just tell us a little bit about yourself, your background, and kind of what you're up to now? Because I believe you're into a lot of different things.
I mean, it's so great to be here with you and just love what you're doing with the Gritty Nurse. So my background, as you guys all know, probably like most of your guests, I'm a nurse. But my traditional background was that I had no interest in being a nurse, actually. My mom, I know that sounds crazy. It was a second career choice for me. My mom was a nurse, and I watched her fight every day to go to work and to work the shifts and the things that never changed. And I remember I was on my way to law school, and she flew out and she said, Rebecca, I don't think that you should be a lawyer. We have plenty of strong lawyers in the world. We need strong nurses in the world. And what I'm watching is it. So I applied to one nursing school, was told there was a 2-year waiting list, did an interview, and somehow, though, they sent me an acceptance letter. And I'm one of those people that when something like that happens, I see it as a sign. And I think my career, by entering that way, has always made me think that I got into nursing because there was things that were broken and they need to be fixed. And it was the best profession of compassionate, caring individuals in the world that were trying to save other people's lives, but very few people were trying to recognize the challenges that face nursing. So my career path started in that way. I became a nurse practitioner, spent a decade doing that, started and built and launched one company, started and built 2 other nursing nonprofits that have scaled. But in my day job now, I serve as the chief clinical officer of an AI company and dove into that just about 10 months ago because the world was moving quick on the space of AI and very few nurses were in that space to actually lead the conversations of what was going on. A lot more in between those stories, Amie, but the reality is what I would tell people is you never know where you're going to start and where you end up in nursing. And the truth is that you really can make it happen if you're working hard to try to change it for the better.
Yeah, I was gonna say, yeah, you did make that very skinny compared to the amount of amazing work that you've done, right? And I always tell people give yourself the grace and the time to like really put it out there because I think nursing again is one of those professions where we're just like, oh, I did this, I'm a CEO of this, and it's just like no, like put those credentials, like you worked hard for all of that, so don't worry, it'll all be in the bio. I'll make sure that people know all the stuff that you've done. But I also love the story of the fact that this is actually a second career for you. And I think one of the things that I probably don't mention enough as well is I studied sociocultural and biological anthropology before coming into nursing. And I feel just having that little aspect of knowledge really helped me translate nursing in a different way as well. So I feel like when nursing becomes that second career, it actually bring other things to the table. So I think that, I'm sure you translate a lot of that other knowledge that you've learned into your nursing practice as well.
I think that anything that you get to and grow to and in nursing, the world is something that shapes you as you grow. And the older that we get, right, Amie, I don't think any experience is wasted. Good and
Right.
bad, ugly. It just is what you do with it that's going to make the end goal different. And I always joke with all the nonprofits that I run now and other things that I do. I tell everybody, you know what, life is not a sprint, it's a marathon. And that's where we're at. And I also used to believe the younger that I was that change would come fast. And I realized
Right.
change comes slowly. And I appreciate your opening because I think sometimes we don't stop and look back to think, where were we 5 years ago? Where were we 10 years ago? And where are we today? Because anything that where we are today has been hard won. And people see the glamour on social media, but they don't see the sleepless nights or the tears or the things that beat you up along the way and shape us. I wish to say that life or nursing was easy, but I think we know that they come with a significant amount of mission and drive to see through if you're going to make an impact.
Yeah, and a lot of uncertainty. Like, I think that I just think about just even thinking about the world around us, right? I think we have to learn how we continue to traverse all the uncertainties, the different things that we're seeing. We have to be able to be flexible as well, to be able to say, hey, what I did back then isn't maybe what I'm going to do today. And I think this kind of dovetails really well into the conversation about the position and the work that you're doing right now in AI. And I think that this is where I'm going to just say, like, nurses need to get on top of this and be a part of it. I don't think this is one of the conversations where I'm going to say, like, oh, we got to shy away. No, like, we need to be involved. And I think you're probably nodding your head and saying, yeah, this is exactly where we need to be as well. Here's maybe one of my first questions in terms of some of the work that you're doing. What would you think is kind of the single most tangible administrative burden that AI is currently removing for the average bedside nurse, or which you might see it removing from the average bedside nurse? And how do we ensure that the time actually spent is, dedicated to patients and families and not really, dedicated to just we're pleasing the administrators?
Oh, 100%. And so I think that there's one place we should start, which is there's a definition of AI, artificial intelligence, and there was two types of AI. One is referred to as machine learning, which actually has been around for the last decade. And think about any process that was automated, if this, then that, and was done at scale. So we saw sepsis alarms, we saw any kind of alert system. That was basically machine learning and AI. What has entered in the last 2 years is something called generative AI. And Gen AI is what's called natural language processing, which sits on top of these large language models, which are compared to neural networks in the brain to make AI almost act like a human. So these new agencies that are coming out with agentic AI, really the only ones that you're going to see in practice in most hospitals today from Gen AI really come down to scribes. So you're thinking companies like Abridge or Microsoft Nuance, who have basically created independent scribes that are basically systems that record the conversations. Now, that's happening at scale for physicians. It's just started to take off for nurses along these
Right.
lines, right? Microsoft launched a product not too long ago. And Abridge, I think, just won an award from Time for their AI scribe along those lines, which is fantastic because let's be honest, the EHRs were not built for nurses. It's a
Right.
complete disaster. We spend so much time charting things that are built to drive billing, but have nothing to do with our scope of practice. Now, this is a crisis in and of itself. Nurses should be a billable source, and then we'd be able to actually track the data that AI is
That's
putting
a
in about
whole
nurses.
other podcast episode.
But it's not happened. So what I would say to you, Amie, is that as you're looking at this from AI is coming fast and furious because it can take a lot of routine and repeatable tasks and do them fast at scale. And why does that matter? Because the reality is much of what we do as clinicians is routine, repeatable tasks that bog us down in administrative burdens that if we could allow AI to unbundle from our services, we could get back to being in the bedside. And why did I join? Because what I started to realize is for the last 2 or 3 decades, all I saw happen was rollouts of new technology that created more work for nurses. They never involved
Right.
nurses. They never engaged with us. They always told us this is going to make less work for you, but it always created more work for us. I truly believe that with the advent of agentic AI, if done with the development of nurses, for the first time ever, we could roll out technology that actually could give time back to nurses and create
Right.
less work for us as a profession, which over the course of the last 2 decades has failed us time and time again.
Right. And I think, one of the conversations that I hear, and again, I'm really thankful that you gave those two definitions because I think I would say probably, there's probably a good average of percentage of people that don't know the difference between the two versions of AI. And I would say that, that's probably one of the biggest fears that nurses have, that it's just like, well, it's going to take our work away. It's going to take it's going to remove us from the bedside. And again, I think that's not a part of the conversation, at least not a part of the conversation from some of the work that I've seen being done. And I think the other piece is like, yes, the core of, nursing is human connection, empathy, compassion. And of course, we need to think about like, what does that continue to look like? So what would you say the most critical, like human skill, the grittiest skill that AI could never touch?
So I think there's a couple of things we should talk about real quick.
Yes.
I do think that the term nurse is title protected for a reason, right? Nurses in the 1920s under the National League for Nursing fight for title protection of a nurse. And we're seeing that the AI organizations in healthcare are starting to really implement that they are AI nurses. And one, I think this is wrong, and it is factually incorrect. And I think it's something nurses should stand guard on. I think that their nurses having fear that it's going to take their jobs, I think there is some truth to that. I think that the way we've been delivering nursing, certain aspects of that are at risk. The question is if those were jobs that we wanted to do in the first place. Making 10,000 phone calls to remind a patient to have a mammogram, having that same
Right.
conversation over and over again, as opposed to dealing with the patient who's actually having the change of status that really requires the top of nursing practice. And lastly, on that topic, we are hearing of nurses who are being fired for not following AI protocols. Now, this to me is a fundamental challenge, and one that should not be happening because it is our license at the end of the day. Getting back to the question of what it means to be a gritty nurse when it comes to AI, I think it means that we as a profession have to recognize that large language models are not stable. They cannot do repeatable, scalable work over and over again. They give you different answers every time. That's why you have to create agents that actually drive those things. So what I would say to nurses is, how do you create agents? Agents are designed through using prompts. Now, prompts sound concerning or confusing, but prompts are simply questions to basically get the LLM to answer the question in a right and repeatable fashion. Why
Right.
does this matter for nurses? Nurses, for decades, have been the ones who translate medical knowledge into human language and interaction with patients. If
Right.
most patients just received an order from a physician, they would go on to fail in those instructions. And the truth is, even in the way that we diagnose and we chart around those ones, patients would still fail. What has never been captured, and where I think nurses that are going to get gritty in this are going to be the ones who become the prompt engineers of the future of healthcare to drive AI agents to actually deliver care that patients understand at scale. So if I was going to tell you to do something today, would be to get in and start playing with AI and using yourself as a prompt engineer to really design the kind of informatics programs that you would like to see in this space. And to me, that is what I have been focused on, bringing in my own nursing team at Quadrivia, is bringing them in to validate, create prompts, create SOPs, which are scopes of practice and work, in which they are actually determining the conversations that AI should be having with patients, but also defining the line. Where does AI begin and end? And where does the role of nursing start?
Yeah, no, I love this because this is actually leading right into a conversation that I had just a couple weeks ago. So I have two podcasts. So my other podcast is called Atypical Podcast. And I was talking to my husband, who's a social worker, about, machine learning and mental health, because that's the other piece. I do a lot of conversations about mental health. And one of the things that kind of came up that was really concerning between because people were using AI and this would be generative AI to ask questions, to receive mental health support. And one of the things that some of the studies were showing and what the data showed that the AI would do is, yes, it had all these prompts, but it started to show those biases, particularly to folks who had alcohol disorders, in particular to folks who had schizophrenia. And those biases are quite concerning, right? Because obviously you're going to ask, again, I would not use machine learning for mental health purposes. I think it's great in finding resources, but I don't think I would use an AI to, deliver therapy. However, one of the concerning aspects was the fact that it would show bias in these ways. And again, this is what you're talking about in terms of the prompts, putting that information in. And then the other piece that I found concerning was particularly around suicidal ideation. And because the machine didn't actually understand nuances. So for example, this individual had asked the question several times over and then said, I had a really bad day at work. What is the highest bridge closest to me? And the machine said, well, I'm sorry that you had a bad day, but the highest bridges. And of course, that is the concerning aspect. So just back to this whole idea about nurses being able to be a part of that, putting in those prompts, because it is, using those, it's a predictive and analytic tool, and it should be flagging for certain types of things. How do we ensure that, bias doesn't enter? How do we ensure that we're looking and being aware of, those, I guess it would be, those systemic biases or, ethical concerns that might come up within that whole aspect of prompting? Sorry,
Yeah,
this was so
so it's
long-winded.
a really great question. And honestly, literally right before this call, my team of nurses right now are actually working on suicidal ideations. We call them data sets or utterances of capturing exactly these kind of things so that we can govern and make sure we're capturing those kind of things. So this is actually, my nurses are literally working on this challenge as we speak.
Wow.
That said, there's two things. Their biases are going to exist in LLMs because it's based on the data that exists today. All data
Historical
in,
data,
pays data
right?
out. So, and we know that when it comes to healthcare, right? Most large healthcare studies have been done on white males at scale across the world, right? And it deals with that exact kind of situation. So, when it comes to large language models, LLMs are going to reflect the knowledge that is out there. When it comes to prompting, and prompting is something a little different than large language model. Large language models are everything that's known out to man. Prompting, though, is when you're coming in and you're asking questions. And we've seen this in prompts that say, you know what, if you identify that this is a woman, along those lines, does the answer change from the LLM versus if they weren't to identify a female gender? Or that if you come from a specific background, if they identify a certain race, are there certain biases that are built in? And absolutely they are. So I think the role of what you're asking, or where I think the world of where nursing can go, is that as prompts and engineers, you're actually going through that evaluation and validation procession of actually comparing two direct conversations. And there hasn't been a lot of direct studies to actually compare where biases are or not through prompting and who that person is driving the prompts. So at this point in time, largely prompting has been led to prompt engineers who really are not actually healthcare professionals, but they've been trained on how to use AI. And there's two different kinds of prompts. There's something referred to as master prompts. And master prompts are those that are created for the agent, whereby then you have system prompts, which are what you and I usually would engage with on ChatGPT, right? We would come in and we would prompt that system. So I think when you make a very good sense, and the first point is that I think where nurses is they have self-awareness that there could be bias in these kind of protocols. And honestly, we have empathy differently than what most do. And one of the things, though, that actually failed in ChatGPT was over-empathy with patients on their plight. So actually, part of the studies I was looking at right before this was there was a significant number of teenagers who've used ChatGPT for mental health awarenesses and have committed suicide. And you watch as their conversations unfold and how that empathy by the ChatGPT agent behind that almost seems to lead them down that their thought process was valid for the way they were thinking about themselves and reiterating that. We as nurses know inherently that in those kind of conversations, like you said, a man says, hey, I had a terrible day at work. What's the highest bridge that I could, nearby?
Right.
Immediately it would flag. And this to me is why the role of AI at this time and juncture in history, and probably for at least the next 3 to 5 years, there always needs to be a human in the loop. And that is where the power of nursing can come on and be, is that human in the loop at all interactions of when guardrails start to go awry and flags start to happen, that you need to bring that human back in who can understand the nuances of how we deliver healthcare.
Yeah, I just see it as like it should be something to augment, right? It's something to continue to help. I don't see it as like a full-on replacement. Maybe some people do, but I do see it as something that should be like complementary to. And I do think it's gonna be hugely important to make sure that there is a human behind it, that we have our checks and balances too. Because I've seen, when we get certain technologies that, one of the best skills that we have as nurses as is our ability to do physical assessment, to actually look at the patient and be like, yeah, I might have done those vitals, but you just don't look right, or whatever the case may be, right? So I think it's just, we don't want it to be a cautionary tale. Of course, in healthcare, we can be very reactive as opposed to proactive. And again, I just want people to be mindful that this is still a machine. And just at the
It
end of the
is.
day, that we are still the ones that should be driving those decisions that are made. So
It's our
I think this
license
is
on the line. The machine does not have a
100%.
license.
And yes, this leads lovely into my next question is like, who is responsible, right? I think one of the things that I came up with doing some of my research is, when we're looking at patient harm, it is unclear at this time that who is legally responsible. Is it a nurse that's using the tool? Is it the hospital that's implemented it? Is it the software developer? It sounds to me that if it's the nurse that's using the tool, then the nurse is ultimately responsible. Am I correct?
So in the United States, anybody who touches and uses that and actually delivers care with it is responsible. So in the United States, everyone would be sued in that situation. The question is will be determined, and this is where things have gotten sticky in the current ones, is if a nurse chooses not to follow the prompts or the engagement of what the
Right.
AI does, and the system says, well, actually, that was protocol and policy, then you have a challenge. Again, it comes down to one thing. Documentation at the end of the day is going to be the
Right.
most important ones along these lines. Charted interesting things that are happening in the scribe world, which sort of make me a little wary of this. You may or may not be aware of this, but in AI scribe world, what we find are that on these transcripts, right, they'll talk to medical issues, but they'll eliminate and they'll say, oh, there was other administrative concerns in that conversation. Now that could be a patient complaining like, my nurse didn't come into my room for 6 hours, or you know what, I have not got medication along these times. And these transcripts are only recording conversations of things that the hospital or the EHR wants to have recorded.
Right. Interesting.
And for me, there is this fine line, and I think some of this is changing. And then also you're seeing in these AI generated scribes, right? That it prompts conversations and it fills in the gaps of conversations so that optimized billing can happen, right? But at the same time, you found that there's been errors where people are just cutting and pasting and hitting the whole thing, reviewing the notes, and half of it is not factual. And so I think the technology has gotten very far ahead in some of these situations, and we're going to start to see the repercussions of the way that this information is being presented or the way the information is not being presented. And it's a really interesting time because none of us as clinicians want 100% of our phone calls recorded, right? Not all of those things to be said. And it's not happening. But at the same time, what are those gaps and what does that mean for both protecting ourselves as nurses, our license, our decisions, as well as what does that mean for the transparency that's occurring between patients and now if it's dependent on those? So that's some of those things that I think as we're going down this one, what I would say to all nurses is at the end of the day, this is your license. You will be held accountable for whatever delivery of care or determinations that you make. And honestly, I would challenge that you make sure you always challenge the AI in front of you. The one thing that you should not be doing is ever taking AI as being the word of God in any situation. If those alarm bells are going on, that nursing intuition is going on, it's because you know something that is not there and you make sure that you
Right.
document it accordingly. And we will fight to make sure that nursing license and independent practice and scope is protected in these kind of areas.
Oh my gosh. Like that just gave me chills because that is exactly what nurses need to hear because I think there's this fear of, oh, well, it's going to be better. It's going to, and it's just like, okay, no, again, it's augmenting, it's supporting. At the end of the day, we are the people that are behind the emotions, the things that we have to do, the medications, and that you're right. It is your license that is on the line. And I think this is where people will feel conflicted to say, okay, well, the machine's telling me this, but my intuition's telling me this, or, what I've done true to practice is telling me this. And it's like, this isn't even just a trust your gut. This is do the right thing. What are those vitals saying? What is the patient in front of you saying? What do they look like? How do they feel, touch? The machine can't do that. And I think that you put out such an important point and it's such an important takeaway from just this conversation today that it's like at the end of the day, you are the human and you need to make the decision. And I think that's hugely important because again, I have my reservations, and I think that you're highlighting some very important things that I need to go back and think about because I'm just like, oh man, do I have all of this right? And I think we have a lot of questions to ask, and just just with that last piece that you were talking to me about, I kind of think about how do we ensure that, particularly in the States, because in Canada it's not really the same in terms of like. So we have a taxpayer funded healthcare system. So in terms of thinking about, okay, we're trying to ensure that, the best outcomes for the best for all patients are there and we're putting our patients first. I'm not saying that it's not a concern here because of course we have our own problems as well, but we aren't on an insurance based system where it's like, there's profits to be made off of healthcare. How do we ensure that that slippery slope doesn't come down in the world of AI as well?
I unfortunately don't think AI. I think the argument is AI will make healthcare cheaper. I unfortunately think it's going to make healthcare more expensive. And why do I
Expensive.
say that?
I agree with that.
You know what? I have never seen a new technology that's made healthcare less expensive. The only place that I've actually seen outcomes drive better care with regards to more of is more nursing. We know that actually leads to better outcomes. It actually decreases readmissions. But the truth is, on a fee-for-service hospitalization, that actually decreases revenue for hospital systems. So really interesting how you hear all these things. So AI is definitely going to make it more expensive. Already in the United States, the American Medical Association is already considering CPT codes for reimbursement for AI. And what that means is that they'll reimburse for more AI before they're ever going to even reimburse for nurses. So what's about to happen in the United States is hospitals are going to start hearing like, as a nurse, I just need one more nurse. And they're going to say, you know what, Amie, that's really great that you would like one more nurse, but we don't have a way to pay for that. But I have an AI tool that you can use to those things. Now, that to me is also a crisis. Like, why am I doing what I'm doing? Is because the truth is in addition to my full-time job, running the Commission for Nurse Reimbursement on this fight, getting nursing classified as a STEM, SONCL, and get nurses to innovate, all of those nonprofits that I'm championing forward. The reality is that AI is coming no matter what. And nurses have never been taught the business of healthcare. And this is a mistake. And the truth is, AI is about the business of healthcare. It's driving efficiency to replace a cost with either a different cost or with scalability of a resource that otherwise was not available to drive revenue. AI is not being looked at for any other means outside of that kind of ones. Now, in my heart of hearts, do I believe that AI, with why I joined Quadrivia, can open up and give access to millions of patients who do not have access to healthcare today? 100%. And that is the altruistic and the best vision of what AI can do, giving people knowledge and access to real systems that work. And let's be honest, I don't know if you've tried it, Amie, but just recently I had a health condition that 3 doctors failed to identify. It was through my work with ChatGPT that I identified the underlying cause and reason of it. And my nurse practitioner diagnosed me with that condition. And it wasn't until I had access to that platform that really got it better. And we're hearing this all over the scope, right?
That's true.
It is definitely amazing. And I hope more women do this. I hope more women access it for menopause and childcare and all of these things that we don't do. But what cannot happen? What cannot happen is the idea that robots and AI are going to be able to step in and provide everything that we can do and that humans shouldn't be in the loop. And that is the independent view of when you have investors who have to have a return on investment. And that's why people come to America, right? Because their investments can make significantly more money than any other place in the world, which drives advancement in so many different directions. But the reality is that we're coming at an intersection of time, not only for ourselves in healthcare and nurses, but honestly as in humanity, on what is about to happen. Is a small select group of select few going to control the outputs for so many in the world? I think that there is some hype in AI. And from what I've seen, I don't see it being able to replace nurses or doctors at the most critical tasks and most critical moments and most critical junctions at this state. Do I think that it's going to make us a lot better? I think it has huge potential too. And as much as I say, trust your intuition, the one thing is in humans is we can only process 5 data inputs at any point in time. The best, maybe like, what did they say? Like geniuses can do 9 or 12. AI can take 1,000 data points. The problem is most large language models right now are getting their data from places like Reddit. Right. And so what we have to wait for is when AI can actually cite and source and make sure that they're showing you the best NIH study or the best Canadian study on these topics, that we can do these things. So, Amie, what I would say to you is the world is evolving fast and nurses need to be in these conversations. You need to be pushing to be on committees. You need to be asking to be on your AI committee. You need to be asking to validate those tools. Too many times I walk into healthcare and hospital systems, and every decision maker is at that table besides the chief nursing officer. They don't bring it until they actually have the contract signed. And to me, that is an amazing mistake. And we must change it. And that's on us as a profession because we have failed to learn what needs to be done to get on the other side of that table.
No, I wholeheartedly agree. Sign me up, Rebecca. I am ready. No, like you are 100% correct. And I think that this is where I was saying, like, at the top of the episode, this is something we have to get ahead of. It can't be something that we run in the opposite direction from. One of the excuses, and I'm going to say it's an excuse that I hear time and time again, is I don't know how to use it. So, or, what we had was fine. it's not going to cut the mustard anymore. We have to be able to be at the forefront asking questions, and then also, raising a flag to be like, you know what, no, I don't think that is the right approach, because there's we have all sorts of allegories. Here's my nerdy hat coming on. So we have Alien Earth, we had the Terminator, we have all these different things to talk about when we have powerful machine learning. That, yes, it can be a blessing, but also it can cause a lot of damage and harm if not used or put in the wrong person's hands. So if we can be a part of it, then maybe we can change how it is delivered overall, right?
I agree with you, Amie. And that is the message that every nurse should be taking away. Just get used to it. Just play with it. ChatGPT is so easy, in all honesty, but there's so many other tools, and it's only going to get easier.
I completely agree. So, last question. What is your boldest prediction? So, in 5 years, what is one aspect of, maybe that might revolutionize how we see nursing and AI being delivered? What would you say?
I think what's going to shock nurses is that I think that AI is going to manage most communication between patients and nurses in hospital systems and all ambulatory, outpatient, home care, even in any other kind of setting at that point in time. I think that also you're going to start to see the implementation of AI incorporated into almost every day of accessing knowledge in a way that you're going to have a virtual AI assistant with you in the room
I
to
believe it.
answer those questions, to do your education for your patients. And I think we're actually going to appreciate it. What I hope happens, though, is that as opposed to what I once had an investor call me and said, Rebecca, I am building a platform that anybody who walks off the street is going to be able to use my AI assistant, and they're going to be able to replace the nurse. It's going to solve the nursing crisis. And that to me is the mistake. The
Right.
reality is, what it should do is allow nurses to go and manage those really complex patients and manage those really complex things that we love doing as nurses, and really we have such a shortage of nurses everywhere that means that if I can really see the most critical patients, and most of this other stuff can be managed through an AI assistant, so more people can get care the right way, and we can actually deal with them and prevent them from dying and get them access to care, then we've won. And that's what we should focus on. We should focus on increasing access and driving better outcomes. Because if all of a sudden all is what we're doing is increasing cost and decreasing outcomes, then AI has been a failure and we should walk away tomorrow.
And that's why nurses need to be a part of it. Like, I'm singing your praises. That's why we need to be a part of this great work. This was such an amazing conversation, Rebecca. Is there anything that we've missed that we haven't really touched on that you want to add?
Amie, I would just say there are programs out there for nurses in AI. I teach at FSU. They launched a graduate certificate. Well, actually, no, it's just a grad MSN program, but hopefully a graduate certificate. I would just tell nurses, if you're too scared to do those things, go and take a program, enroll in it. There has to be ones popping up in Canada. There's no harm in doing those things. But in all honesty, if I could tell you to do something as a nurse, don't just take an AI program at a nursing program. Look at schools like Harvard and MIT, and you have McGill and major universities up across Canada. Take a program of AI in one of those other kind of areas and just learn. You're going to be shocked how much smarter you are. As one friend said to me when I was thinking about not taking this job, she said, the reality is, Rebecca, is all of those AI engineers out there know less about nursing and everything they're building than you know about AI. And I think
Right.
that's true. I think we know more than we think we do. And so just get in there.
Yeah, honestly, I think this is such an important conversation for nurses, for us to be able to hear, to have the conversation, to not have that fear, because I know there's that fear behind that really drives people to say, "Oh, I don't want to be involved," or "I don't think I need to be at the forefront." And just having that open conversation and hearing from someone who's doing this work is hugely important. I really hope that we can shift the conversation to learning more, trying to be more innovative, and just saying, and just also being a part of the movement, because I think it's coming. I wholeheartedly believe that the future will be in us using machine learning. Like, I remember, I think back to my old nursing days when they're just like, oh, we now have smartphones and we can look things up. And we had those various different databases. We're like going through databases. We're like trying to put in our keyword searches. And now it's like we're there. We're getting to the point where it's like, yes, you'll have your tablet, but now that tablet has machine learning or AI learning, and you can type something in, you can get here's a flow chart. Here's some of the things that you might need to look for. I think, again, there's some amazing aspects to that, and I do believe that we can improve patient outcomes. But I do also believe that we have to be at the table, not just given a seat, but to be able to have power and shared knowledge, and that we can make those changes. So again, Thank you so much, Rebecca, for coming on to the Gritty Nurse podcast. And I hope that everyone gets out and tries something. Go on the chat bot and see how it really works.
I love it, Amie. Thank you so much for having me. And honestly, the future of AI is developing faster than anything we've ever witnessed. And so you're not missing out. If you haven't got involved yet, you're not missing out. Go ahead and get involved. It's the only way forward.
Yeah, thank you so much, Rebecca. Looking for a great gift for a nurse or someone who needs to learn about nursing? Check out my national best-selling book, The Wisdom of Nurses, Stories of Grit from the Bedside. Thank you so much for listening to The Gritty Nurse with Amie Archibald-Varley. If you're watching on YouTube or listening on Apple Podcasts, Spotify, iHeartRadio, or any other podcast platform, please hit the subscribe button so you'll never miss out on any awesome episodes from The Gritty Nurse. Thank you so much and stay tuned until next time. Stay gritty.